So tingly legs and leg circulation and issues are very common in hands. So Raynaud's or blue, white, pale hands and feet are very common. We know Raynaud's can happen 20% of the patients with POTS due to poor circulation, impaired nerve vascular squeeze, nerves control microcirculation. Challenges that Raynaud's can be associated with autoimmune in some cases. Most times it's problem with the nerve vascular squeeze or poor perfusion to the arms and legs distally, because from your heart to your fingertips, it's about 3 feet, and to your feet, it can be 3.5 to 4 feet or longer, depending on the person's body height. So tingling, achy, burning limbs are very common in POTS due to many reasons. One is just poor circulation. So, reason why we're going through this, it can mimic nerve pain, which is burning, tingling, aching, electric. So, poor circulation because you're just trying to keep the blood to your core so you don't pass out, get to your core organs of your gut and your heart and your lungs and your kidneys. That you can have burning, tingling, aching, just to poor circulation to your arms and legs. It can manifest at those weird feelings, and also the muscles don't behave as well in repetitive, high demand stamina, including walking. So you just get this achiness, tingling, burning of your arms and legs, skin color changes, and that can get that just through poor perfusion of that level. Nothing that leads to a level of what we call necrosis or gangrene. I've occasionally people ask that question, but just basically poor achiness and cold limbs you can have. Also, adrenaline can cause heightened senses. It's an activation, so your skin gets very activated. So you'll notice a lot of times tingling, prickly, almost like the sense when you eat hot peppers, that your skin gets very activated. So adrenaline will do this. And the reason why we're going through this one is that we've known in our publications and research that about 15-20% of people who we see who come to us at a national level and we're neuromuscular autonomic may have small fiber neuropathy. By our evaluation, some problems with the nerves that control the blood vessels. More commonly, people with Ehlers Danlos, autoimmune, and maybe there are people we see with POTS who are in their 30s or 40s or 50s at onset. In the COVID patients, the nerves that control the microcirculation, so they're not squeezing as well to push the blood back upward. And so they have that mechanism. Usually we can tell the people with small fiber neuropathy at first glance by a very detailed neurologic exam. So when we examine people, when you look at reflexes and feeling and touch and vibration and pinprick, we can tell those people very well. If we need other testing to confirm things, that tells us very good accuracy, the power of the neurologic exam. So again, we're going through this video to look at people, like you'll notice if you have more poor circulation by the color, the temperature, changing positions, time of the day, activity, tingling related to adrenaline. You often have more adrenaline symptoms of jitteriness, feeling can't think, racing heart rate, that sort of outsourced adrenaline feeling. And then also the neuropathy will often be figured out by a very good neurologic exam. So a quick teach about achy legs and weird leg sensation. Thank you.